Hello friend, in this video we will tell about the clinical skill. Okay, what is the clinical skill and for the first year how it's important. For example, if you go to the first year, you have to read about the basics, not about the clinical. But in the home, etc., all of people tell you as a doctor, doctor, doctor. Okay, so for that purpose, you have to understand the overview of the clinical skill. So in this video, we will just tell about the overview of the clinical skill. Okay, so you have to just overview, not go deep on this. Okay, for this purpose, you have to let's understand the importance of clinical skill. One thing is emphasizing patient-centered care. Okay, that how clinical skill contribute to building strong doctor-patient relationship. You have to understand this. If there is a patient, you have to make a relationship with them. You have to just like a brother, just like your elder little brother. You have to make empathy, sympathy on him, that how much importance that they need of mine. Okay, so another thing is about the theory. When you in the class or in the final year, etc., you have to read a lot, but you need a practice too. Okay, so you have to about the theory and the practice, you have to make a bridge. Read and practice, these three are two are more important thing. Another thing is about the communication skill. One is the doctor and one is you, so between them there is a strong communication. If there is strong communication, you will become a great doctor. Because are you understand that there is a famous doctors, they are famous not just about the knowledge you have. If there is a specialized doctor, all of them have a knowledge, but the most important thing is about the communication, that how you communicate with the patient. So you have to improve your communication skill. Another thing is physical examination technique. What physical examination technique? Because on the hands on training, for example, there is a your hand. Okay, so in your hand there is ulnar artery, radial artery, ulnar artery. You can palpate easily radial artery, ulnar artery. There is a test. If you block these both of them and grab your hand. Okay, after grabbing your hand, open your hand and just open one wall, one artery. Okay, and see that the hand become red or not. Okay, this is just hands on training. So you have to increase your hand on training, that how much physical examination can you increase. Okay, another thing is clinical decision making, integration data, formulating different type of diagnosis in the in your field. You when you move to a final year and how job, you have to this clinical decision making. So you have to understand that there's will be a decision making for you. The patients will be lying on the bed and you have to prescribe a drug. You have to something. They will they will they they in the they will be in the battle of the death and life. Okay, so between these there is a doctor and that will be you. So you have to strong focus on your study to that after some time you can make a decision. Okay, another thing is medical documentation. What is medical documentation? Importance of accurate record keeping. For example, if a patient come, they have a record of their previous treatment, etc. Okay, so medical documentation is very important, because on the basis of the previous thing, the doctors prescribe the futures treatment. Okay, patient safety and infection control, this is very important. Also patient and yourself. If you are a doctor, you touch some patient. You, for example, there are three patients, you touch one person, then second, then third. But for that part, between them you have to sterilize your hand. This is the WHO rules, and WHO said that between two patients there will be a sterilizations, and you have to just sterilize your hand, and after that you can go on the examination, because this decrease the infection to the patient and infection to you. Okay, for example, you touch one patient and at the same hand without sterilization touch another patient, there must be infection spreading. Okay, another thing is introduction to basic procedure. There is many basic procedure you have to understand. You have not to lying yourself. You have to not just tell that these things are about the nursing, etc. Not, it's about the nursing, but you have to understand the basic. For example, if there is an emergency cases, you have to uh, do it on yourself, not just waiting for the nurse. Okay, that is intravenous access. For example, you intravenous access, there is a vein, you have to access to the vein through the injection. Okay, and another is wound caring and suturing. For example, if there is a wound and something is damage in the skin, etc., you can sutures technique. Okay, another thing is culture, competence, and sensitivity, understanding diverse patient background. For example, there is a patient, two patient, they have, both of them have diverse background, and you have to understand about the background, that what deficiency, etc., occur in that thing. Another thing is utilization, stimulation, role and playing. Stimulate patient in counter how stimulation, exercise, role playing enhance clinical skill in control. For example, if you are in your medicals, you have to go to the hospital, you have to practice many things. Okay, many clinical skill, this will help you a lot. Okay, another thing is seeking feedback and continuous improvement. One thing that, for example, intravenous is so easy, but for some doctor it they can't do intravenous injection because they have no practice. So you have to practice and then get feedback that how are you are improving or not. Okay, so these are the basics things that you have to understand in your medical field, so much important. Thanks for watching.